Hi, my name is Siamak Abai, and I'm originally from Iran. Moved to the United States when I was 10 years old. Moved to right here in Southern California. Went through junior high school, and college within the same 5-mile radius, which I'm really proud of. I was accepted to Columbia University Dental School in New York City. So I moved out there when I was 21, finished dental school at 26. Continued on to advanced education in general dentistry for 2 years before joining a practice back here in Huntington Beach for 2 years. I had some experience with dentistry before deciding to move on to prosthodontics. I was accepted at Harvard, I moved back east again for 3 years, and once that was completed, I moved back home. And I've been practicing here in Orange County for the past 3 years. My practice has ranged from implant dentistry to aesthetic dentistry, reconstructive dentistry, so whatever encompasses under prosthodontics and comprehensive care for my patients. Right now there are a lot of advancements in dentistry, as you can see with a lot of the companies out there that are utilizing digital technology. A lot of companies are coming out with newer cone beam CT scanners that are a lot less, provide a lot less dosage to the patient when you take the cone beam CT scan. They're specifying the direction, and there's a smaller window. For example, if you want to take a CT scan of a certain area, there's the technology to be able to do that. On the other end of things, in terms of intraoral scanners, there are many companies that are coming out with intraoral scanners. So I think the wave of the future really is being able to utilize that technology in order to take intraoral scans and utilize that information for whatever that's out there in terms of fabricating crowns for single units, or taking a digital impression of a full arch of a patient that might need immediate dentures, but you can't take an impression because you don't want to extract any teeth in your impression. So you can utilize that information and send it to the laboratory and have them fabricate you a complete denture. So there's a full range of technology that's coming out right now, and actually has been out for a while. It's just being fine-tuned, and I think there's going to be a lot, there is going to be a lot stronger push for this technology to be utilized by the dentist. Digital impressions have really transformed what we do in dentistry in terms of getting rid of a lot of the analog impression making, fabricating stone models. There's a lot of inaccuracies that are involved in that. So if you can relay information from the patient's mouth directly to the laboratory without going through those steps that have inherent inaccuracies, it's an advantage to the dentist. They're extremely accurate across the range with many different systems, and you can have a restoration back much quicker than you would by going through all the normal lab steps. So for example, you take a final impression of the patient's prepared tooth, you can actually email that information to the laboratory, and the email gets there fairly instantaneously. The lab technician can pull it up on their design program and design a crown and be able to fabricate a final restoration through CAD CAM technology. There are a lot of advantages. It's an evolving field, but I think there's going to be more focus towards that in the near future. Yeah, absolutely. I think as dentists there's a lot of inherent misconceptions because of our training. So we'll learn how to do a lot of techniques through traditional methods, and anything that is promoted by companies we're very skeptical about. So it's very difficult for a dentist who's been practicing traditionally to switch over. However, there's actually been a lot of interest in dentists who want to utilize the technology. So I've seen a lot of dentists that have been practicing for 20, 30 years that want to take on the new technology. In terms of CAD CAM abutments, what I really like is it's not just necessarily the CAD CAM abutment. I like being able to streamline what we do from going from the patient's mouth to fabricating the CAD CAM abutment. So right now we have the technology to be able to uncover the implant and remove the healing abutment, and we're able to place a scan abutment on the implant and be able to scan the area and send that information to the laboratory. Where CAD CAM abutments come in is that the laboratory technician has the technology in front of them where they design on a computer screen all the contours of your final abutment, which is then sent to a milling machine. So it takes away some of the inaccuracies of having to, for example, wax and cast a UCLA abutment. Instead, you're able to design the CAD CAM abutment on a computer screen and have full control. And one thing that helps that level of control is the technician having all the dimensions of the area that you're able to scan. So it could be a lot more accurate because there are less hands involved in the process. You don't have to create a tissue model and pour a stone model. You're able to go directly from the actual anatomy in the patient's mouth to the laboratory where it can be fabricated. What I like about CAD CAM abutments is the utilization of zirconia, which there are a lot of studies out now that's showing that zirconia is very gentle to the tissue, and tissue healing around zirconia has been shown to be really advantageous for the patient, resulting in less inflammation and less bone loss. In terms of CAD CAM chairside milling units, there are a lot of good units out there. It really depends on what your practice is leaning towards, whether you'd like to do one-day dentistry. The option is obviously there to do that. Or whether you're more traditional like myself, where you would like to take even digital impression but have a laboratory fabricate a final restoration for you. So nowadays you send that information to the laboratory, and they're also utilizing a milling device to fabricate the final restoration. However, a lab technician might have more control over different staining techniques that you might not have at your disposal when you're utilizing a chairside milling machine. So personally, I would prefer to send the information in terms of the final impression to the laboratory, but that's a personal preference, and the options are there to be able to mill a full contour restoration chairside. It's been around for many years, and it's only going to continue to get better. In terms of fabricating a final abutment before the implant is actually placed, that's actually already been done. It's here now. In Europe, it's been a little bit more advanced than here in the United States. A lot of the research that I've been involved in the past 2 years has been focused on digital treatment planning, fabricating final full contoured restorations even before the implant is placed, or if you want to fabricate a full contour custom abutment, the options are there. It's just a matter of being able to utilize all the technology and really combining the technology with all the biological considerations. That's probably the most important thing is even though the technology makes up for a lot of the details that we can leave up to the technology, we still have to be mindful of the treatment planning and the biological knowledge, which is never going to go away. So I came here to the Global Institute for Dental Education to present my research in the past couple of years, which was really, it started when I went to the Greater New York Academy of Prosthodontics meeting 2 years ago, and a very talented dentist from Amsterdam was presenting, and he was delivering final abutments at the time of implant surgery. However, it was based on a stone model. So when I saw that lecture, and the following lecture was a zircon Zahn lecture with milling units and everything. So I was starting to put everything together in terms of trying to push the field a little bit more. So when I came back home to Southern California, I got together with my research team, and we brainstormed, and what I wanted to do was be able to place the implant and deliver final abutments or final crowns based on a completely digital model and not utilizing any sort of analog impressions or stone models. So my lecture here today was about taking intraoral scan and also taking a cone beam CT scan and utilizing a digital treatment planning software to merge the two data. Some of the software is very robust. So under the software, what you can do is once you import it and combine the data, you can do a digital wax up. So you know exactly where your final restoration is going to be, which is, from a prosthetic standpoint, the most important thing. You know where your teeth are, and you match where your implant goes based on that. So the diagnostic wax up is completed, the implant is placed virtually. That information is relayed to a stereolithography machine for the printing of a surgical guide. And also the same information is sent to the laboratory for the fabrication of a custom abutment or a final crown. And the clinician, the advantage is the second visit will receive all that material from the laboratory and will be able to place the implant with a high degree of accuracy and place the final abutment or final crown at the time of surgery. A lot of advantages, for example, not being able to disturb the abutment implant junction once the implant is placed, obviously is advantageous for the patient. And also being able to complete a treatment in 2 visits could be advantageous. Obviously, you might want to spend more time with your patients, and I talked about that a little bit during my lecture as well. So some of the advantages and disadvantages are very similar. Oh, well, you know, in my free time, I like to play a lot of basketball. So I grew up playing basketball with the same group of people for the past 25 years. And now we're a lot older and slower, and we can't jump as high, but we still get out there and you know, give it a try. And I also enjoy gardening, and I think with gardening you form a relationship with the plants, and it's one of those things that you connect, you create a bond and you have a connection, and every day you get up and you want to see how your plants are doing, which I think is important because in dentistry is very similar also. You form a relationship with your patients, and it's a very caring environment, and you have to be able to relay that information to your patients. So gardening and patients have some similarities in that sense.
For more education programs, visit the Guide Institute at www.guidedental.com.